Good evening and welcome to BATV Health Guide. Today's edition will focus on a health issue that affects couples around the world, but is often surrounded by silence, stigma, and misconception, and that is infertility. To guide us through this important discussion is a consultant obstetrician and gynecologist, Dr. Abdullahi Mohammed Kabir. He will help us understand the causes of infertility, available treatment options, and when couples should seek medical attention. Dr. Abdullahi Mohammed Kabir, you are welcome to the ATV Health Guide.
Thank you very much.
Before we start, when we say infertility, what do we actually mean?
Thank you. In a layman language, infertility is the inability of a couple to achieve pregnancy after staying together for 1 year. That's 12 months. That is infertility. I said couple. I didn't say a woman. It's important to emphasize this because a lot of times people think infertility is a problem of a woman. It's a joint problem. A woman cannot get pregnant. A lot of times the problems can come from either side or even from both sides. So I said couple. So the problem is from the two, not from one. So that is infertility.
Okay, so it's expected that when they get married, within a year,
Yes,
pregnancy should occur.
yes. And then they must have adequate intercourse because we expect when a couple are trying to get pregnant, they should have at least 3 intercourse in a week. Um, that is what we call adequate. It must be also unprotected in the fact that they should not be using any form of family planning when they are trying to get pregnant. So they must have spent 12 months, must have been having adequate intercourse, unprotected. So when these definitions and these criteria are satisfied, we said there is infertility. Has various forms of it. We have what we call primary infertility. It's said to be primary when a woman has not conceived before at all. Even miscarriage she never had. So that is called primary infertility. When there was previous documented pregnancy in a woman, irrespective of the type, whether it resulted in delivery, miscarriage, or even ectopic pregnancy, that is secondary. Because she has had pregnancy before, now she cannot conceive. All secondary infertility. So it's important because for us as doctors, it has a lot of implications.
So how often or how common is infertility?
Infertility is very common. Uh, World over, the infertility is increasing every year, every year, across all strata, across all uh, social group and whatever. So um, seems like the situation is not different here. If you go to gynecology clinic, see patients. At the moment, I think if you take uterine fibroid out, but the infertility is one of the commonest. Up to like almost half of patients have infertility. There are reasons why it is becoming common. Before I go into the reasons, actually, um, the cause of a lot of problems in society, the cause of social problem, cause of marital disharmony among couples, has caused a lot of divorce Why? Because especially in this environment, childbirth has been attached to so much importance because of the role that a child plays in our traditional society. We believe, a lot of people believe that you don't have a child, then you cannot have nobody to inherit you and all that kind of. So once a couple stay for some time without pregnancy, you begin to hear complaints, and most of the complaints end on the woman. Find out the complaint come from the husband himself sometimes, the in-laws,
The
particularly
in-laws.
the female ones. I
Yeah,
must say this.
mother-in-laws.
Just yesterday, I was doing a clinic. I have come across a woman who the sisters of the husband are in a very serious situation. And it's very common. You always hear that kind of problem. Sometimes you find out that the problem is even from the man, whereas the relations are pushing. The situation I had yesterday, man had the problem, but they thought it's and they encouraged him and he went and took a second one. Even when we know it's his problem, he was able to keep the problem between the two of them, but they push him. And so it's a cause of marital disharmony, a cause of social problem in the society. So until when people understand that not having problem is not a disability, so not a problem. A lot of people will get pregnant easily and deliver. Some will need assistance. And the big challenge is that people don't pursue the solution to the problem. Mostly they pursue the problem. So it's a big problem. It's a very common thing and a very big problem. I think we need to do a lot to educate people about it and understand how to handle the or approach the problem.
When you talk about the issues of in-laws, when our parents, when you get married, your mother start asking after 1 month whether you don't have fever, you don't feel somehow because it's the tradition. But what are some of the causes? What leads to a woman or a man having the issue of infertility?
Yes, I think a lot of explanations, a lot of ways to categorize the cause of infertility. Um, Overall, we say when there is problem in that is infertility, if you take it as 100%, 30% from the woman, the cause is from the woman. 30% of the other cause is from the man. That's 60%.
Yeah.
Then in another 30% is a joint problem. You find out the woman has issue and the man has issue. Then that is 90%.
Yeah.
The remaining 10% we call it unexplained. There are some patients you will come and evaluate, you will not find the cause of infertility during basic evaluation. Not that the cause is not going to be. If you go and do some very high tech evaluation, will get to the root of the matter. So, but we say 10% is unexplained following basic evaluation. So that is the contribution of the various part of you know, the man and the woman to infertility. But when you look at the etiology, that is the cause, um, we categorized it like this. We say male factor, female factor, because it's man and the woman. So if you look at the woman also, you can also look at it as a problem of some of them not being able to produce egg. We call it anovulatory causes or ovulatory cause. Ovulation is egg production. Every woman produces egg every month. Some women have difficulty producing egg. So some they have what we call oligo ovulation. This one they produce egg, another one they will not produce it. like those that have polycystic ovarian syndrome, what we call PMOS nowadays. So that is one, ovulatory in the woman. The second cause in the woman is what we call tubular factor. This has to do with problem in the womb or in the fallopian tube, which is the, like, what do I call it? The sides, the hands of the tube with the uterus. So the womb is what carry the pregnancy. In some women, you find out that they are born without uterus. There are a few of them. They don't have uterus. They don't menstruate. In the very beginning, they don't menstruate. So those ones, we call them Merrick-Kitensky Kuster syndrome. There are those that they have the uterus. They might have even delivered later. You find out that they develop adhesions within the uterus. The inside of the womb, which is supposed to be the cavity, is fused. Following, like, surgeries on the uterus, like uterine fibroid surgery, following cesarean section to deliver a baby, or following manual vacuum aspiration for removal of incomplete B and C that people will not say. So that can cause the inside to get fused. Sometimes you could have the tubes getting blocked. So this issue with the uterus or the tubes can be caused by infection, surgeries, or trauma from any form. So patients that have mostly commonly in this environment, this particular cause infection is the commonest. So, and that happens because a lot of women will get the infection because of maybe poor health seeking behavior. For some of them, they don't even know that this is an issue that they need to go to the hospital. They will stay with the infection, and then it will destroy the tubes until when they get married, they want to get pregnant, they will have difficulty. This is the second cause in the woman. So the third one is male factor, which actually that is just the problem. Having the man having low sperm count, you know, or you have sperm that they don't move. Most of them are dead. The number is adequate, but the cells are dead, or they are very, very few of them are mobile. The sperm need to move from the vagina to the tubes so that it can fertilize the egg. So when it has poor movement or it doesn't move, it's a problem, even when the number is adequate. So these are some of them. Sometimes the shape of the sperm cells themselves. So also men completely they don't have even sperm. They don't have even sperm. And that is mostly a problem due to blockage, mostly caused by infection in the men or surgery. And sometimes it's a problem from the testicles. The testicles have, like, they can no longer produce sperm again. So those are issues mostly as a result of infections, either in the childhood. There's this mumps that that men have in the children have. So if a man has had mumps or orchitis, risk of having problem producing sperm cells. Sometimes surgery, some you have to undergo surgery like ordinary hymenoplasty because the tract that carry the sperm from the testicles to outside can be injured during procedures like post-scrotal surgeries like hydrocele and all that. So basically three causes, ovulatory causes, problems that have to do with ovulation, tubular causes, problems that have to do with tubal blockage or adhesions within the uterus, or even abnormality of the uterus right from delivery. And lastly, the male factor, which has to do with the sperm quality or quantity. So these are the causes of
And so with all these causes, we're supposed to discuss about whether there's problem of infertility from the man, medical, and we've discussed that. So what are some of the treatment options for a person who has a woman or a man who has this condition?
yes. The treatment of infertility depends on the cause of the infertility. When couples come for evaluation, when we evaluate them, at the end of evaluation, we'll identify the problem is ovulation. This one is tubal factor or uterine factor. The other one is male factor. So the treatment is directed at the cause of the infertility. A lot of times you find out when the problem is due to ovulation, that's difficulty producing egg. The commonest cause is polycystic ovarian syndrome we have. We now call it PMOS, polyendocrine metabolic ovarian syndrome. So what they need is ovulation induction. These are drugs that are given that will forcefully make the woman to produce eggs. He takes that every month, and if she's lucky with that, and sometimes some have problems that are medical problems that are responsible for the problem of the ovulation. So you treat that medical problem that is stopping the ovulation. When you manage it well, the woman start ovulating. And like for example, some may have what we call hyperprolactinemia. There's production of prolactin. Prolactin is a hormone that normally causes a woman to produce uh, breast milk. It's mostly seen high in those that are breastfeeding. So for some reason, some women will have it high when they are not even breastfeeding, and it will stop ovulation. Once you give drug to treat that, ovulation will spontaneously come back. So that is for those that have ovulation problems. Sometimes when the treatment with oral drugs cannot work, we go to higher things like injections. So that is for the ovulatory factor. For those that have problem that is male factor, meaning that the man has low sperm count, there are drugs we give, various form of drugs that will boost the sperm number and movement. So when you give the drugs, mostly you review and repeat the test. When everything has improved, that will help them in getting pregnant. For those that their problem is on the womb, those that have adhesions within the womb, what we do is we go and do a surgery to open the inside of the womb so that space will be created for the pregnancy to settle. But where the problem is on the fallopian tube, meaning that there is blockage in the tube. Nowadays, we hardly do surgery. Those days, people do surgery to open the tube because the tubes are too delicate. Most of the time when surgeries are done, they end up making the problem bigger. So nobody does surgery again, especially now with advent of in vitro fertilization, IVF. IVF circumvent the tubes. So you just refer the patient for IVF. In those that they don't have uterus at all, it's also there is a hope for pregnancy if the culture of the person permits. You can have surrogate mother. A surrogate mother is a woman who is commissioned to take or carry pregnancy on behalf of a couple, for a woman who has issue with her tubes. and she can do that voluntarily without any material benefit. Some they can be commercial surrogate and make arrangement with them to carry the pregnancy. The woman, the mother who's the actually the genetic mother, will be stimulated through a process of IVF to produce the eggs, and then when the eggs are harvested, the husband's sperm is collected, then fertilization is done outside. When the baby is formed, the baby is transferred to the surrogate mother who carry the pregnancy to 9 months. After delivery, based on arrangement that is legally bound, the baby is transferred back to the genetic mother. So those are options for those that have difficulty with their womb or they have issue with their womb. So all these are what we do, generally. But where there is difficulty getting pregnant with all these processes, the ultimate thing is ART, which is assisted reproductive techniques. There are various forms of them, from intrauterine insemination to in vitro fertilization and embryo transfer, what you call IVF-ET, to ICSI, intracytoplasmic sperm injection, which means there is difficulty in the man sperms. He has very low sperm count. And to pre-implantation genetic testing. All these are various forms. So as it is now, what we normally say is that there is no kind of treatment, there is no kind of infertility that there is no treatment. What determines your outcome of treatment is how far you can go. Yeah, because this comes with a lot of actually cost, and also your culture and your beliefs. What is allowed by your culture and what you believe.
So as we round up, the conversation is very educative. As we round up, a woman has a child, one child, and then does not have again for a very long time. Can we also call that infertility?
Okay, she has delivered before.
Yes,
and
and
she
then
did
she didn't
she
deliver
didn't
again.
deliver again. Yes, that is secondary infertility. If she has tried to get pregnant for 12 consecutive months after that her delivery, and she could not get pregnant, we call it secondary infertility. Infertility is not whether you have a child or not. It's when you try getting pregnant, you could not get pregnant. It depends on whether you have delivered before, we call it primary infertility. If you have not delivered before, we call it secondary.
So what's the place of age in this issue of infertility?
Very important. Very important. In all, anytime we are treating infertility, there's what we call the outcome or prognosis. You need to discuss with the couple what are their chances. And there are a lot of factors that determine the outcome of the treatment. And the number one and most important factor is the age of the woman. Because the eggs of woman decreases with increasing age. The quality of the eggs, the number of the eggs. So what we normally say is that after 35 years of age, the fertility of a woman drastically decreases. So it becomes difficult for a woman to get pregnant easily because the number of eggs at that time decreases exponentially, and the quality of the eggs also is affected. Even when she gets pregnant, a lot of them end up with miscarriages because of the poor quality of it. So age is very important. So young ladies, when they have infertility, we always are okay, we are happy because we know uh, the prognosis is likely very good because of the good ovarian reserve and good quality of eggs.
Thank you very much, Dr. Mohammed Kabir. Thank you for sharing your expertise and helping us better understand issues around infertility. We hope the discussion will encourage couples to seek professional medical care when they have the issue of infertility. So thank you very much, Doctor, for coming.
Thank you, Elizabeth.
Viewers, thank you very much for watching this interesting program. Stay with BATV Health Guide next week when we come with another gynecological issue that we'll pick to discuss. I am Elizabeth K. Thank you for watching.